You have been living inside a contradiction. Your body tells you something is deeply wrong. The fatigue that no amount of sleep repairs. The burning sensations that come and go without explanation. The brain fog that makes you feel like you're thinking through wet cement. The dryness that extends far beyond what any eye drop or glass of water can fix. And then you sit in a doctor's office, and they tell you your blood work looks normal. Your MRI is unremarkable. Your scans show nothing concerning. But you know what you feel. You know that something has changed. You know that your body is not the same as it was 5 years ago, or even 2 years ago. This video exists because that gap between what you experience and what medicine can measure is real. And it's not because you're imagining things. It's because Sjogren's syndrome and fibromyalgia are conditions that spread invisibly, quietly, systematically, often for years, before they ever show up on a standard medical test. What I'm going to explain over the next 40 minutes is something that most patients never hear from their doctors. Not because their doctors are negligent, but because medicine is structured to detect damage, not progression. It's built to find what has already broken, not what is currently breaking. And that distinction between visible damage and invisible spread is the key to understanding why you felt dismissed, why your symptoms keep multiplying, and why you may have spent years searching for answers that never quite arrived. By the end of this video, you will understand exactly how these conditions move through the body. You will learn to recognize the patterns that indicate spread, patterns that don't require a lab test or an imaging scan. And you will have the language to describe what's happening to you in a way that makes sense, both to yourself and to any doctor you work with. This is the explanation that should have come years ago. Let's begin. Understanding what happens before tests can see it. To understand why your symptoms are real even when your tests are normal, you need to understand one fundamental truth about how Sjogren's syndrome and fibromyalgia actually work in the body. These are not conditions that suddenly appear one day. They don't arrive like a broken bone or an infection. They develop gradually, often over many years, through processes that happen at a level too small and too subtle for standard medical tests to detect. Let me explain what's actually happening biologically, in terms that make sense. The microscopic beginning. In Sjogren's syndrome, the immune system begins to make a mistake. It starts treating your own moisture-producing glands, the glands in your eyes, your mouth, and throughout your body, as if they were foreign invaders. Immune cells slowly infiltrate these glands and begin to cause inflammation. But here's what most patients don't realize. This infiltration can happen for years before it causes enough damage to show up on a blood test or cause a gland to visibly malfunction. The process begins at the cellular level, with small clusters of immune cells gathering in tissue that appears completely normal on any scan. What you feel during this phase is real. The slight dryness. The intermittent fatigue. The sense that something is off. These symptoms reflect immune activity that is genuinely occurring. It's simply occurring at a scale that current medical technology isn't designed to detect. In fibromyalgia, the process is different but equally invisible. What happens is not gland damage, but a gradual sensitization of the nervous system. The nerves that carry pain signals begin to respond more intensely to normal stimuli. The brain's pain processing centers begin to amplify signals that would normally be filtered out. This is called central sensitization, and it develops slowly. A touch that once felt neutral begins to feel uncomfortable. A level of physical activity that was once manageable begins to cause disproportionate fatigue. The nervous system is changing, rewiring itself to be more reactive, but these changes happen in the intricate circuitry of nerve cells, not in structures that can be photographed by an MRI. Why standard tests miss early progression? When your doctor runs blood work, they're looking for antibodies, specifically, proteins like SSA and SSB that indicate the immune system is attacking moisture-producing tissue. But these antibodies don't appear in everyone with Sjogren's, and even when they do, they often don't appear until the disease has progressed significantly. Studies suggest that up to 30% of patients with confirmed Sjogren's syndrome test negative for these standard antibodies. Their disease is real. Their symptoms are real. But the markers that medicine looks for simply haven't appeared yet. The same principle applies to fibromyalgia. There is no blood test for central sensitization. There is no MRI that can measure how reactive your nervous system has become. The diagnosis is clinical, meaning it's based on symptoms and physical examination, precisely because the biological changes happen at a level that our current technology cannot image. This is not a failure of medicine in the sense that someone is doing something wrong. It's a limitation of the tools we currently have. Blood tests and imaging were developed to detect established disease, tumors, infections, organ damage. They were not designed to detect the slow, subtle cellular processes that characterize autoimmune and nervous system conditions in their early phases. What this means for you is profoundly important. A normal test result does not mean you are healthy. It means the disease has not yet progressed to the point where it creates the kind of damage that tests are built to find. Your symptoms are signals of what's happening now. Your test results are photographs of what happened in the past. The early symptoms that matter. Let me describe the symptoms that typically appear during this invisible phase, the symptoms that doctors often dismiss because they can't be correlated with abnormal test results. Fatigue that feels different from normal tiredness. This is not the fatigue you feel after a poor night's sleep or a long day at work. This is a bone-deep exhaustion that doesn't improve with rest, a sense that your body is working hard just to maintain basic functions. Patients often describe it as feeling like they're running on empty even when they've done nothing strenuous. Burning sensations in the eyes, mouth, or skin. These burning feelings are signs of nerve involvement. In Sjogrens, small nerve fibers in the affected tissues become irritated by the surrounding inflammation. In fibromyalgia, sensitized nerves begin to misinterpret normal sensations as pain or burning. Either way, these symptoms are real neurological events. They are simply not visible on a standard nerve conduction study. Brain fog and cognitive difficulty. This is perhaps the most frustrating invisible symptom. The sense that your thinking is slower, that words don't come as easily, that your memory isn't what it used to be. Research now shows that both Sjogrens and fibromyalgia can affect cognitive function through inflammation and nervous system changes, but there's no simple test that measures brain fog. Internal vibrations or tremors. Many patients report a sensation of vibrating or buzzing inside their body, feelings that are invisible to everyone else but very real to the person experiencing them. These sensations typically reflect small nerve fiber involvement or central nervous system sensitization. Pressure pain in muscles and joints. Not the sharp pain of an injury, but a deep, aching pressure that seems to move around the body. This is characteristic of fibromyalgia, where the brain's pain processing has become amplified, but it can also occur in Sjogrens when inflammation affects the tissues around joints and muscles. If you're experiencing these symptoms and your tests have come back normal, you're not imagining things. You're simply in the phase where your body is signaling a problem that medicine doesn't yet have the tools to photograph. How these conditions move through the body. One of the most confusing aspects of living with Sjogrens or fibromyalgia is watching your symptoms multiply and change over time. You might have started with dry eyes, then developed fatigue, then noticed muscle pain, then began experiencing sleep problems. It can feel chaotic, like your body is falling apart in random ways. But it's not random. There is a pattern to how these conditions spread, and understanding that pattern is one of the most powerful things you can do for yourself. Let me walk you through the typical progression map, the sequence of events that explains why symptoms multiply and how they connect to each other. Stage 1. Immune activation. Everything begins with immune system dysregulation. In Sjogrens, this means the immune system begins targeting moisture-producing tissue. In fibromyalgia, which often has autoimmune features, there's evidence of low-grade systemic inflammation and altered immune signaling. During this stage, you might notice occasional fatigue that seems disproportionate to your activity level, vague feelings of being unwell, possibly some mild dryness or sensitivity. The immune system is activating, releasing inflammatory signals, and beginning to affect tissue function, but nothing is yet damaged enough to measure. This stage can last for years. Most people don't seek medical attention during this phase because the symptoms are easy to attribute to stress, aging, or just having a bad week. Stage 2. Nerve sensitization. As immune activity continues, it begins to affect the nervous system. Inflammatory chemicals released by immune cells can directly irritate nerve fibers. In Sjogrens, this often manifests as small fiber neuropathy, damage to the tiny nerve fibers that sense temperature, pain, and texture. In fibromyalgia, it manifests as central sensitization, the nervous system becoming increasingly reactive to all stimuli. During this stage, you might notice burning, tingling, or numbness in your extremities, increased sensitivity to touch or temperature, pain that seems to come from nowhere, the sensation that your skin is sunburned when it's not. This is often when patients first become concerned enough to see a doctor. But because small fiber neuropathy doesn't show up on standard nerve conduction studies, which only measure large fiber function, tests often come back normal. Stage 3. Brain involvement. The nervous system is one continuous network, and what affects the peripheral nerves eventually affects the brain. As nerve sensitization continues, the brain's processing centers begin to change. Pain signals get amplified. Fatigue signals get amplified. The brain becomes more reactive to stress and stimulation. During this stage, you might notice significant brain fog and cognitive difficulties, emotional changes, increased anxiety or depression that seems to have no clear trigger, heightened startle response, difficulty filtering out sensory information like background noise or bright lights. This is also when fatigue typically becomes severe. The brain is now working harder just to process normal information, which is genuinely exhausting. The fatigue you feel is not laziness or weakness. It's the metabolic cost of a nervous system that has lost its ability to filter efficiently. Stage 4. Muscle dysfunction. As the nervous system becomes sensitized, the muscles that it controls begin to malfunction. Muscles may become chronically tense, unable to fully relax. They may develop painful trigger points, knots of contracted tissue that cause pain locally and refer pain to other areas. During this stage, you might notice widespread muscle aching and stiffness, particularly after rest, specific tender points that hurt when pressed, muscle weakness that doesn't match your activity level, delayed recovery after even mild physical exertion. This is the stage where many patients receive their fibromyalgia diagnosis, because the widespread muscle pain meets the diagnostic criteria. But by this point, the condition has already been developing for years through the earlier stages. Stage 5. Sleep disruption. Sleep is controlled by the brain and nervous system, so as these systems become dysregulated, sleep inevitably suffers. But there's also a cruel feedback loop. Poor sleep increases inflammation, worsens pain perception, and further sensitizes the nervous system. During this stage, you might notice difficulty falling asleep or staying asleep, waking up unrefreshed no matter how long you sleep, specific sleep disorders like restless leg syndrome or sleep apnea, dreams that feel too vivid or sleep that never feels deep. This is often when symptoms begin to spiral, because sleep deprivation affects everything. Patients who had managed their symptoms reasonably well may suddenly find themselves in a much worse state, simply because they've crossed a threshold of sleep disruption that their body can no longer compensate for. The difference between isolated symptoms and systemic spread. Here is the critical insight that most patients never receive. The difference between an isolated health problem and a systemic condition is not the severity of any single symptom. It's the pattern of involvement across multiple systems. If you have dry eyes and nothing else, that's an isolated symptom, probably treatable with eye drops and not particularly concerning. But if you have dry eyes, plus fatigue, plus burning sensations in your feet, plus brain fog, plus muscle aches that move around, that's a pattern. That's not 5 separate problems. That's one condition expressing itself across multiple body systems. This is exactly what Sjogrens and fibromyalgia do. They spread. Not like a tumor growing in one location, but like a system-wide shift in how your body functions. The immune system, the nervous system, the muscles, the sleep centers, they are all connected, and when one becomes dysfunctional, the others follow. Understanding this pattern is the first step toward advocating for yourself. You're not a hypochondriac with multiple unrelated complaints. You're someone experiencing the systemic spread of a condition that medicine isn't yet structured to recognize in its early stages. If this progression map matches your experience, type spread in the comments. Your patterns matter. Learning to see spread without tests. If standard medical tests can't detect early progression, how do you know if your condition is spreading? The answer is pattern recognition, learning to identify the specific signatures of systemic involvement that don't require a blood test or scan to observe. I'm going to teach you 3 patterns that indicate progression in Sjogrens and fibromyalgia. These patterns have been observed clinically for decades, even though they are rarely explained to patients in clear terms. Pattern 1. The flare-crash partial recovery cycle. In healthy people, energy and symptoms follow a relatively predictable pattern. You exert yourself, you get tired, you rest, you recover. The cycle completes and you return to your baseline. In Sjogrens and fibromyalgia, this cycle becomes distorted. Here's what it typically looks like. First, There's a flare, a period of increased symptoms. This might be triggered by stress, infection, weather changes, or sometimes nothing identifiable at all. During the flare, symptoms intensify across multiple systems. You feel worse in every way. Then there's a crash, a period of profound exhaustion that follows the flare. The crash is your body's response to the inflammation and nervous system activation. It demands rest, but even rest doesn't fully restore you. Then there's partial recovery, and this is the key word. You feel better than you did during the crash, but you don't return to where you were before the flare started. Your new baseline is slightly lower than your old baseline. Over months and years, this pattern results in a slow decline, not dramatic enough to notice week to week, but unmistakable when you compare how you function now to how you functioned 3 or 5 years ago. This is the progression pattern. Each flare is an episode of disease activity. Each partial recovery is the new damage that has accumulated. The spread is happening, one flare at a time. Pattern 2, symptom migration. In most common illnesses, symptoms stay put. If you have a knee injury, your knee hurts. It doesn't hurt your knee 1 week and your shoulder the next. The location of the problem is stable. In Sjogrens and fibromyalgia, symptoms migrate. Pain that was in your hands moves to your feet. Burning that was in your face appears in your arms. The specific locations change, but the types of symptoms remain consistent. This migration pattern is a signature of systemic involvement. It indicates that the problem is not in any one tissue or location. It's in the nervous system or immune system that serves your entire body. The symptoms appear wherever that system is most stressed at any given moment. Many patients find this pattern deeply confusing and distressing. They begin to doubt themselves. How can the pain be in my legs today when it was in my arms yesterday? Am I making this up? The answer is no. Symptom migration is not only real, it's diagnostically significant. It tells you that you're dealing with a systemic condition, not a local one. If your symptoms move instead of staying in one place, comment pattern. This is real. This is recognized. Pattern 3, increasing sensitivity thresholds. The third pattern is perhaps the most subtle, but once you see it, you can't unsee it. As Sjogrens and fibromyalgia progress, your threshold for tolerating various stresses decreases. Things that used to be manageable become triggers. Consider these questions. Can you tolerate the same amount of physical activity you could 5 years ago? Can you handle the same level of emotional stress? Can you eat the same foods without consequence? Can you tolerate the same temperature variations? Can you recover from a poor night's sleep as easily as you once could? For most people with progressing Sjogrens or fibromyalgia, the answer to these questions is no. The threshold has shifted. The buffer zone has shrunk. Things that would have been minor inconveniences now trigger full symptom flares. This pattern reflects the nervous system's increasing sensitization. A healthy nervous system has tremendous capacity to absorb and adapt to stress. A sensitized nervous system has lost that capacity. It reacts to everything because its baseline reactivity has been permanently increased. Tracking this pattern over time can reveal progression even when your symptoms might seem stable day to day. Pay attention not just to what symptoms you have, but to what triggers them. If your list of triggers is growing, if smaller stresses are causing bigger reactions, that's evidence of spread, regardless of what your blood work shows. Why these patterns matter more than single symptoms. Medicine is trained to identify diseases based on specific symptoms. This symptom means that disease. But Sjogrens and fibromyalgia don't work that way. Their symptoms overlap with dozens of other conditions. Fatigue could mean anything. Muscle pain could mean anything. No single symptom is diagnostic. What is diagnostic is the pattern, the way symptoms behave over time, the way they relate to each other, the way they respond to stresses. These patterns are the fingerprint of the condition, and they can be observed without any test. This is why patient observation matters so much. You are the only one who sees your symptoms over time. You are the only one who notices when they migrate, when they flare, when your thresholds shift. Your doctor sees you for 15 minutes every few months. You live in your body every day. The patterns I've just described give you a framework for organizing what you observe. They turn a confusing collection of complaints into a coherent narrative that makes sense, and that narrative is the most valuable thing you can bring to a medical appointment. Understanding the medical perspective. Before we go further, I want to address something that causes tremendous frustration for patients with Sjogrens and fibromyalgia: the experience of being dismissed, doubted, or told that nothing is wrong when you know something is deeply wrong. This experience is real, and it's painful. But I want to explain why it happens, not to excuse it, but to help you understand the system you're navigating and to give you tools for working within it more effectively. Medicine is trained to treat visible damage. Modern Western medicine developed around the treatment of acute, visible problems. Infections that can be cultured. Tumors that can be imaged. Broken bones that can be X-rayed. Organ failure that can be measured through blood chemistry. This approach has been spectacularly successful. Conditions that were death sentences 100 years ago are now routinely cured. Emergency medicine, surgery, infectious disease treatment, these fields have advanced tremendously precisely because they deal with problems that can be seen, measured, and targeted. But this success came with a blind spot. Medicine became very good at detecting what has already broken, and much less skilled at detecting what is currently breaking. The tools, the training, the entire infrastructure is oriented toward visible damage. When you arrive with symptoms that don't show up on standard tests, you've fallen into that blind spot. It's not that your doctor doesn't believe you. It's that your doctor has been trained in a system that doesn't give them tools to validate invisible progression. They may want to help but have no framework for what to do when all the tests come back normal. Specialists treat organs, not patterns. Another structural issue is medical specialization. Modern medicine is divided into specialties based on organ systems. Rheumatologists treat autoimmune diseases that affect joints. Neurologists treat nervous system disorders. Gastroenterologists treat digestive problems. Ophthalmologists treat eye conditions. But Sjogrens and fibromyalgia don't respect these boundaries. They are systemic conditions that affect multiple organ systems simultaneously. When you see a rheumatologist, they focus on the joint symptoms. When you see a neurologist, they focus on the nerve symptoms. When you see a gastroenterologist, they focus on the digestive symptoms. No one sees the whole picture. No one is trained to see the whole picture. Each specialist sees their piece of the elephant and may conclude that the piece they're seeing isn't abnormal enough to worry about, missing the fact that all the pieces together form a clear pattern of systemic disease. This is why patients with complex systemic conditions often see 5, 10, or even 20 doctors before receiving a diagnosis. It's not that those doctors were incompetent. It's that they were each looking through a narrow window that only showed part of the problem. Normal labs delay diagnosis, not disease. Here is perhaps the most important thing to understand. When your doctor tells you that your test results are normal, they are accurately reporting what the test shows. What they may not realize, and what you need to understand, is that a normal test result delays diagnosis, but it does not delay disease progression. The disease is progressing according to its own biological timeline, not according to when it becomes detectable on blood work. A patient who tests negative for Sjogrens antibodies in 2024 may test positive in 2027, not because they suddenly developed the disease in 2027, but because the disease finally progressed to the point where it produces enough antibodies to be measured. During those 3 years, the patient was symptomatic. They were experiencing immune system dysfunction. They were potentially developing nerve damage and tissue damage. The test simply wasn't sensitive enough to detect it. This is the cruel paradox of invisible illness. The earlier you're diagnosed, the more you can do to slow progression. But the earlier stages are exactly when tests are most likely to come back normal. What this means for you. Understanding these structural limitations doesn't make the experience of dismissal less painful. But it does give you a different perspective, one that can help you navigate the system more effectively. Your doctors are not your adversaries. They are professionals working within a system that has real limitations. When they say your tests are normal, they're not saying you're crazy. They're saying that the tools they have don't show a problem. Those are different statements. Your job is to help bridge the gap. To document your patterns. To describe your symptoms in terms of progression, not just in terms of what hurts today. To ask for the specific tests that might catch early disease, things like lip biopsy for Sjogrens, or small fiber neuropathy testing, rather than accepting a standard panel as the final word. You are not fighting against your doctors. You are working alongside them, bringing the perspective of someone who lives in this body every day to complement the perspective of someone who was trained in the medical system. The knowledge that changes everything. Now that you understand how Sjogrens and fibromyalgia spread invisibly through the body, and why standard medical approaches often miss early progression, Let's talk about what this knowledge actually gives you. This is not about fear. Understanding progression is not meant to frighten you into thinking your body is inevitably deteriorating. It's meant to give you clarity and leverage, the ability to recognize what's happening, communicate about it effectively, and take steps that might genuinely slow the process. Lesson 1. These conditions spread by systems, not organs. The first and most fundamental lesson is this: Sjogrens and fibromyalgia are not organ diseases. They are system diseases. They affect the immune system, the nervous system, the endocrine system, entire networks that span your whole body. This means that trying to treat them organ by organ, eye drops for dry eyes, pain medication for muscle pain, sleep aids for insomnia, is treating symptoms, not the underlying condition. These treatments have their place, but they don't address the systemic dysfunction that produces all the symptoms. Understanding this shifts how you approach treatment. Instead of chasing individual symptoms, you start thinking about what calms the immune system. What reduces nervous system sensitization? What supports overall system function rather than patching individual problems? This doesn't mean there's a simple cure. There isn't. But it does mean that treatments aimed at the underlying systems, such as immunomodulating medications for Sjogrens or nervous system calming approaches for fibromyalgia, may be more effective than symptom-by-symptom management. Lesson 2. Early recognition can slow damage. There is real evidence that early intervention in autoimmune and nervous system conditions can slow their progression. This is not a guarantee. These conditions are complex and variable. But it is a legitimate reason for hope. For Sjogrens, early treatment with medications that modulate the immune system may prevent or delay gland destruction. Early treatment of dry eye can prevent corneal damage. Early attention to dental health can prevent the tooth decay that often accompanies severe dry mouth. For fibromyalgia, early intervention focused on reducing central sensitization, through approaches like appropriate exercise, sleep optimization, stress management, and sometimes medication, may prevent the kind of severe, refractory symptoms that develop when the condition goes unaddressed for years. The challenge, as we've discussed, is that early intervention requires early recognition, and early recognition requires seeing the patterns that tests miss. By learning to identify progression patterns in yourself, you're potentially giving yourself access to that early intervention window. Lesson 3. Tracking patterns gives you leverage. When you understand the patterns of progression, the flare-crash partial recovery cycle, the symptom migration, the decreasing thresholds, you have something concrete to work with. You have data. This data is valuable in multiple ways. First, it helps you make better decisions about your own life. If you know that certain activities or stresses reliably trigger flares, you can make informed choices about whether to engage in them. If you know that you're in the crash phase after a flare, you can give yourself permission to rest rather than pushing through. Second, it helps you communicate with doctors. A vague complaint of "I feel terrible" is hard for a doctor to act on. But a documented pattern, "My symptoms flare every time I'm exposed to temperature changes, and each flare takes longer to recover from than the last," is specific, trackable, and clinically meaningful. Third, it helps you evaluate treatments. When you try a new medication or approach, you can assess whether it affects your patterns. Does it reduce flare frequency? Does it shorten the crash period? Does it stabilize your thresholds? These are measurable outcomes that don't depend on a blood test. The simple act of paying attention, of tracking your symptoms over time and looking for patterns, transforms you from a passive patient waiting for tests to tell you what's happening into an active participant in understanding your own body. Lesson 4. Validation is part of healing. Finally, I want to acknowledge something that doesn't get said enough in medical contexts. Understanding what is happening to you is itself therapeutic. The experience of having symptoms that no one can explain, that tests don't validate, that doctors dismiss, this experience is psychologically damaging. It creates a kind of epistemic trauma, a wound to your basic sense of reality. You start to doubt your own perceptions. You wonder if you're crazy. You feel utterly alone. Having a framework that explains your experience, that shows you the biological logic behind what you're feeling, can relieve some of that burden. It doesn't cure the disease. But it does cure the isolation of not understanding. When you can say to yourself, "This is how Sjogrens progresses, and what I'm experiencing fits that pattern," you reclaim your reality. You're not crazy. Your body is following a recognizable trajectory. Other people have experienced exactly what you're experiencing. You're part of a community of people who share this journey, even if you've never met them. That knowledge, by itself, is worth something. What you've been through matters. Before we close, I want to speak directly to what you may have experienced over the course of trying to get answers about your health. You may have been told it's just stress. That you're depressed and that explains everything. That you need to exercise more, sleep more, worry less. That there's nothing wrong because the tests don't show anything. You may have been referred from doctor to doctor, each one finding nothing in their area of expertise, until you ran out of referrals or ran out of energy to keep seeking help. You may have started to wonder if they were right. If maybe you were imagining it. If maybe you just needed to try harder to be normal. I want you to know that your experience is shared by millions of people with invisible illness. And I want you to know that your symptoms were real even when no one could prove it. The doubt that comes from medical dismissal is one of the cruelest aspects of conditions like Sjogrens and fibromyalgia. It's not just that you feel sick. It's that you have to defend your right to feel sick. You have to convince people that something is wrong. You have to fight for basic validation of your own experience. That fight takes an enormous toll. It takes physical energy you don't have. It takes emotional resilience that gets depleted. It takes time you could have spent resting, healing, or just living your life. If you've been through that fight, if you're going through it now, I see you. And I want you to know that your experience is valid, regardless of what any test says. The isolation is real, and it's not your fault. Living with invisible illness can be profoundly isolating. You look normal. People expect you to function normally. When you can't, they don't understand. How do you explain fatigue that doesn't respond to rest? How do you describe pain that moves around? How do you convey brain fog to someone who has never experienced it? So you often don't. You stop trying to explain. You learn to hide how much you're struggling. You cancel plans with excuses that are easier than the truth. And gradually, your world shrinks. This isolation is a natural consequence of having a condition that others can't see or understand. It's not a personal failure. It's not something you did wrong. It's just what happens when your reality doesn't match what others expect. But you're not alone. There are communities, online and in person, of people who share this experience. People who will believe you without requiring proof. People who will understand without requiring explanation. Reaching out to those communities, when you're ready, can help repair some of that isolation. If your tests came back normal but your symptoms weren't, type invisible in the comments. You're not alone. Self-doubt is a symptom, not a truth. I want to name something that often goes unspoken. The self-doubt that comes with invisible illness is itself a symptom of the illness. It's not an accurate reflection of reality. When your brain is affected by inflammation, when your nervous system is dysregulated, when you're exhausted and in pain, your thinking changes. You become more vulnerable to negative thoughts. You become more likely to believe the worst about yourself. The disease creates the doubt. So when you catch yourself wondering if you're just weak, if you're just complaining, if you should just push through, recognize that thought for what it is. It's not wisdom. It's not insight. It's the disease talking. The same nervous system dysregulation that causes your symptoms also causes the thought that your symptoms aren't real. You can acknowledge the thought without believing it. You can notice the self-doubt and let it pass, like any other symptom. It doesn't define you, and it doesn't determine the truth. Moving forward. We've covered a lot of ground in this video. Let me summarize the key insights you can take with you. Sjogren's syndrome and fibromyalgia spread invisibly through the body, often for years, before they produce the kind of damage that standard medical tests can detect. This is why your symptoms can be severe while your blood work is normal. The test measures damage. Your body signals progression. These conditions follow recognizable patterns of spread, from immune activation to nerve sensitization to brain involvement to muscle dysfunction to sleep disruption. Understanding this progression map helps you make sense of why your symptoms multiply and change over time. You can learn to see spread without tests by tracking 3 patterns: the flare-crash partial recovery cycle, symptom migration, and decreasing tolerance thresholds. These patterns are clinically meaningful even when your labs are unremarkable. Doctors miss early spread not because they are negligent, but because medicine is structured to detect visible damage, and specialists are trained to treat organs rather than patterns. Understanding this helps you work with the system more effectively. Early recognition matters because early intervention can potentially slow progression. And tracking your patterns gives you leverage in understanding your own body, communicating with doctors, and evaluating treatments. If this information was helpful, I'd encourage you to save this video and return to it. These concepts often take time to fully absorb, and you may find that different sections become more relevant at different points in your journey. If you want to learn more about the specific mechanisms of nerve sensitization and how to address them, that's something we can explore in future content. If you want to go deeper into symptom tracking methods, we can cover that as well. Let me know in the comments what would be most useful for your situation. Whatever path you're on with these conditions, I hope you now have a clearer map of the terrain. You're not lost. You're not crazy. You're navigating a difficult journey with inadequate tools, and now you have a few more tools to work with. Thank you for your time and your attention. Take care of yourself.